Hello everyone, how are you? Today's topic is the surgical anatomy of the breast. So here we can see the breast. The breast is a modified sweat gland, which is an skin appendices, and the breast of adult female it overlies of the on the pectoral region. That means overlying the pectoral fascia or overlying the pectoralis major and minor muscle. So first of all, the boundary of a breast or in a female breast. So it extending from the second rib above to the sixth rib below or inframammary case. So this point is extremely important that the breast it extends above from the second rib and it extends below up to the sixth rib. So from the second rib to the sixth rib, and the sixth rib at this level inframammary crease present. So boundary upper part it is second rib and lower part it is sixth rib. Then here we can see the medially it extends up to the lateral border of the sternum, which is a midline bone, and laterally it reaches up to the anterior axillary line or mid axillary line. So these points are very important regarding the boundary of the female breast. So again, the boundary from above to below second rib to sixth rib, and medially it is the lateral border of the sternum, and laterally it is up to the anterior axillary line or mid axillary line. Here we can see the breast, and this breast the different part of the breast. First of all, here we can see this is the nipple and areola, and together it's called nipple areolar complex. And the breast it overlies a fascia, and this fascia is the pectoral fascia, and just below the pectoral fascia there is the pectoralis major muscle and also the pectoralis minor muscle. And here we can see it extends. This is the second rib up to the sixth rib, and this is the inframammary line or inframammary fold. And some other important structures such as the suspensory ligament of the Cooper. Here you can see this is the suspensory ligament of the Cooper, and it extends from the dermis of the skin up to the pectoral fascia. So now here you can see adult male breast tissue is rudimentary. That means is very small, and it is composed of nipple and areola, and it is 2 centimeter in diameter, and it lies deep to the areola, extending up to the areolar edge. So it extends very little area. Then breast parenchyma or breast tissue is composed of the ductolobular tissue and supportive tissue. So this point is very important that the ductolobular tissue and supportive tissue, this both from the breast. The terminal ductule together with the lobular constitute the terminal ductal lobular unit, which is TDLU. So TDLU, that means the terminal ductolobular unit. It is the functional area of the breast. And here we can see terminal ductal lobular unit is most active part of the breast tissue and responds to a number of the hormone. So terminal ductolobular unit, it is the most active part of a breast, and it responds in different hormones such as here we can see estrogen and progesterone. And estrogen progesterone as they are more in female, so female breast is more larger than that of the male. Then here we can see the prolactin and the growth hormone. So four important hormone acts directly on the breast: estrogen and progesterone, prolactin, and growth hormone. Then here we can see there are 5 to 9 major lactiferous duct and carrying milk from the breast lobe. So in this picture here we can see this is the this black area represented the lactiferous duct, and this lactiferous duct carries the milk. Approximately 10 to 100 lobules empty via ductule into the lactiferous duct, and each lactiferous duct is lined with a spiral arrangement of contractile myoepithelial cells. This point is also very important. The myoepithelial cell, they are present around the lactiferous duct, and this myoepithelial cell is important for the breast and it usually present in the breast rather than other area, and it causes contraction of the lactiferous. It gives pressure to the lactiferous duct and causes ejection of the milk. So here we can see this is the direct snapshot from Bailey and Lab, showing the orientation of the alphabet in the different part. And here this point says most disease of the breast are arises from TTLU, that means the terminal ductolobular unit. About 50% of the ductolobular tissue is located in the upper outer quadrant. So this point extremely important to remember, uh, because if we divide the breast into four parts, such as this is the breast, and if we divide it in this part, that means the upper and outer quadrant, it contains 50% of the TTLU, that means the terminal ductal lobular unit. So 50% disease arises from the this upper and outer quadrant, and 20% from central region. So in the central region, 20%. So if we examine the upper and outer quadrant and the nipple areolar region, so about 70% examination is completed. So this information should remember very carefully, that the upper and outer quadrant of the breast, it contains 50% of the ductolobular tissue, and the central region, it contains 20% of the central of the breast tissue. And here during breast examination, particular attention must be paid to upper and outer quadrant, because it contains 50% of the ductolobular tissue, and a retroareolar region and nipple areolar complex, because nipple areolar complex, it contains 20%. So 50% and 20%, that means the total 70% of the breast area, and this 70% examination completed when examine upper outer quadrant and nipple areolar complex. So first of all, we have to give attention to the upper outer quadrant and the nipple areolar complex for any disease of the breast. And now the supportive tissue of the breast are formed by the suspensory ligament of Cooper, the ligament which attaches with the pectoral fascia to the dermal fascia of the skin, then adipose tissue, blood vessels, nerves, and lipetics. So they are the supportive structure of the breast. This point, the ligament of Cooper are attached to the undersurface of the dermis superficially and to the pectoral fascia deeply. So when the cancer infiltrate in this ligament of Cooper, then ligament of Cooper shorten, and the dermis, it dimples inward, and it gives the characteristics important feature, which is the pseudo orange feature. So here we can see this is the another snapshot from the Bailey and Love. Thank you all.